Good afternoon, everybody. It is now Thursday, a long week in this war against COVID-19. Remember, we as a Commonwealth, as a country, and as planet Earth are at war against this one in every 100-year pandemic. And it means we got to show up every day, do the work, follow the guidelines to protect the health and lives of those around us, to protect our economy, and ultimately to do everything we can to get our kids back in school. Today we're going to give our daily update. We are going to get an update on contact tracing, and then we will open it up to questions fairly early. But let's start with what we're seeing overall in the country. Again, it is more cases than we could have ever imagined, day over day over day. We have seen many states spike in a very dangerous manner, and while it looks like they may be plateauing off, some of them are plateauing at tens of thousands of cases. We're starting to see the deaths that follow that. I think Florida is setting their record just about every day. Then we're seeing a set of states that appear right on the heels of the Florida, Arizona, Texas. Alabama's gotten bad, Oklahoma's increasing, and many others out there. And then you have us, in a place where we don't want to be, a danger zone, but again with the time to do things right, and I believe more than most states, taking early action to make sure what we have seen to our south and to our southwest does not happen here. I want to again go over the 4 different steps that we are taking. Number 1, mandatory facial coverings. Dr. Birx could not be more clear, and Dr. Stack could not be more clear about the absolute necessity of everybody wearing a facial covering and the fact that it won't work. We won't stop the escalation unless it's mandatory. Anybody who tries to undo the mandatory nature of it is going to tank our response to COVID, and that'll ultimately cost lives of our people and major damage to our economy. Every major employer is now saying what we know is true. The health of our economy depends on our ability to control the virus. Wearing a facial covering, wearing a mask is the number 1 thing you can do if you're an open the economy advocate to make sure that it can stay open. Number 2, we have got to make sure we are limiting our social gatherings to 10 or less. It's the right thing to do. It's the patriotic thing to do for our state. And folks, you don't want your house to be the place where COVID spread in a large group of people. Bars closed for 2 weeks. I did see, and I haven't gotten to fully read it, an op-ed on the fact that we need better guidance as well as better compliance. I agree. We'll need to work on that to make sure at the next opening we can do it better, and that should be on our end too. And finally, limiting indoor capacity of restaurants to 25%, but order takeout. Sit outside if you want to go to a restaurant. Make sure that we do everything we can to support these businesses. In many ways, it is not their fault, but these are the steps that give us the maximum output, the maximum chance of curtailing where this virus is. And then, don't travel. Don't travel. Too many stories about people who thought it was in a good place or that they could just stay at a house alone in Florida and the devastation that it's caused in their families. We have so many businesses right now, and their struggle is not preventing the virus in their facility. It's somebody bringing it back from vacation. We see this in healthcare entities. We see it in manufacturing. We see it in our professional services. So please, don't travel, because it's not just going to potentially, or even in some of these areas, likely infect you. You're going to shut down your workplace. You may pass it around in church. Nobody wants to do that. I know I haven't asked for this in a while, and I didn't tell James, but can we put up the top 10 rules on healthy at work? He's going to have to look for that. But let's remember that we need to make sure we are still following the very best practices. You know, one that I believe that we are not doing very well is continuing telework where possible. I think the further that we've gotten into this virus, the more people have tried to pull 100% of their employees back in the office. That doesn't help. We're in this for the long haul until we get a vaccine and until that is actually administered to a world. So remember, these 10 rules are really important, and when you start letting up on them, that's when the virus gets out of control and unchecked. So please review the top 10 rules. I was actually talking to a couple of folks on Zoom today. One is a football coach trying to certainly restart or do more in their area, and listening to him go over how they think through every single day the extra things they can do for their players. If we all adopt that at our work, again, we can stop this escalation. So today's report is generally what we've been seeing, in that we hope we are at a leveling off or a plateau. So our cases are a little up from yesterday, but our positivity rate is down because we've had more tests. So today we're reporting 659 cases of COVID-19. That is out of 11,217 tests. Our positivity rate today is 5.66%, and that is down. Now, we have a total number of cases we've now reached at 29,386, 29,386. It means we'll reach 30,000 soon. And it's hard to think that we can have hope in numbers as large as 659, but I want to read you the numbers for the last 3 days of this week, and then I'm going to read you the numbers the last 3 days of last week. This week, leading up to today, 532, 619, 659. Same 3 days last week, 674, 518, 611. So we believe what we are generally seeing, and James, can you put up the graph for today, is a leveling off, or at least a significant decrease in the overall escalation of the virus. We talked about this a little bit yesterday, that if you look 3 weeks ago, let's look 4 weeks ago, 1,675 cases. It was the most we had, but it was still really within a range. And then you saw a big jump, 800 plus, and then we saw a really big jump, 1,200 plus. And if you're looking at that escalation the next week, we should have had an even bigger bump. I believe this is what we are seeing because of facial coverings, that we at least stopped the significant escalation in that last week we're showing, and we believe we're going to be somewhere in that zone at the end of this week. So what all the models show is, if we're going to get control of this, we will first level off. We will first level off before we can get a decrease. And it's my hope, again, we need to see more data. It's my hope that this is where we are, but if it is, it's only because we're being really diligent. And I hope what we've learned from when we were down to, say, 914, is that once we get it under control, we have to keep it under control. We can't stop. We can't let up. Until we have that vaccine, we've got to do what it takes. Of our total number of cases, 27,716 are lab confirmed, 1,670 are probable. We currently have 587 COVID patients in the hospital, 110 in the ICU. Those numbers are generally good. They say that we still have time to get control of the number of cases before our hospital system would get close to being overwhelmed, though regionally we are seeing some issues here and there. Now's the time. We've seen what other states have gone through. Now's the time where we start winning, or this thing gets out of control. And at least what we believe we're seeing out there is people working really hard. Please wear that facial covering. Every time you're around people, it will go a long, long way. We are sadly reporting 7 new deaths today. They are a 92-year-old woman from Greene County, a 65-year-old man from Christian County, an 81-year-old woman from Ohio County, a 63-year-old woman from Simpson County, again, more and more people in their 60s, a 70-year-old woman from Warren County, 82-year-old man from Greenup County, and a 75-year-old man from Casey County. Continue to see far too many cases of kids under 5. There are 22 of them today. 22. Pike, Trigg, Harlan, Monroe, Hardin, Jefferson, Fayette, Warren, Ohio counties, all over Kentucky. Remember, everybody can get this, and let's make sure that we're doing what it takes. I always think about the fact that wearing this makes me less likely to bring this virus home to my kids. That's enough for me. I hope it's enough for everybody else. New cases by county. These are cases with 10 or more. Jefferson 138, Fayette 42, Warren 22, Laurel 20, Hardin 18, Shelby 15, Grace 15, Henderson 15, Christian 14, Davis 14. There's a lot of Western Kentucky today. Kenton 13, Mercer 13. It's one of the first times I remember Mercer being on the higher number list. Barron 12, Oldham 12, Scott 12, Franklin 11, Pulaski 11. And then we've got Callaway and Knox each at 9. So again, we know that we are in this battle. We know now is a critical time. It appears that facial coverings are making a difference, and the new things we put into place, it hadn't been long enough for them to have an impact. So our goal, and what we're going to wait to see, is to really start seeing not just a leveling off, but we hope to do even better than that. Ethnic and racial data, it will be up on our website. It's virtually the same as I read yesterday, so I'll start doing that every couple days, but we're going to post it on the website so everybody can see it every day. Long-term care, numbers down a little bit, not down, but the increase is less than yesterday. 12 new residents and 18 new staff testing positive. No new deaths today attributable to patients in long-term care. 5 new facilities. Slight uptick in our child care facilities. 2 new facilities with at least 1 COVID case. 3 new staff have tested positive, and 4 new children. I'm going to ask Dr. Stack now to come up. He had talked a little bit before about the fact that it's not just death, which is what we report, that COVID can cause other harms, and it's important that we prevent it in everyone that we can. He talked about some other viruses and what we had later learned. I'm going to talk a little bit about what either some of the recent cases or even some recent studies show on the harmful side of COVID-19.
Thank you, Governor. James, could you put up the bar graph that the governor used for one more time, please? I get a lot of interesting communications, as you might imagine, in this position. I'm going to go over with you sort of where we are, where we started in this journey and where we are now, and bring it up to what the governor asked me to talk about, which is the other potential implications of COVID-19. So I want to show you this. Where we are today is very different, obviously, than where we were in February and March. But if you look to the left of this bar graph, when the bars are much shorter, what I'm looking for is not just the height of the bars, I'm looking for the rate of change across the bars. And so if you look to the left, we had 4 cases, 16, 84, 335, 516, 1,008. You started having near doubling. That's the beginning of an exponential growth curve. That's when you go, I think when you're looking on TV, that's where you go like this, where it just goes like you're going up Mount Everest. That's scary, because when that happens, that's when things rapidly get out of control. And if you look at those down there, that was back in March. That's when we didn't know much about this disease, and we had models that were showing that 45 to 90,000 Kentuckians could die in less than 1 calendar year if the disease swept through the state in a rapid manner over a period of months or even over the balance of the year. That was very scary. It was enough to scare people who don't normally get scared, like leaders of nations and leaders of states and the people that advise them. So you'll notice then we entered a long sustained plateau. We were healthy at home, and then we did a phased reopening. We tried to do healthy at work. We asked people to follow guidelines, and we did a great job. We kept our line almost flat compared to the rest of the country, and we did it for multiple months, almost 3 months in fact. And then you see when we started to have the escalation happening in other parts of the country, which was a really bad escalation, you start to see a big climb again, 1221, 1482, 1675, then a big jump, 2482 and 3772. You start, not quite doubling, but you're starting the beginning of that progression, which you saw on the far left at much smaller numbers. That's scary again. Now I'm going to put this in context. So first of all, I am not trying to fearmonger. I am not trying to terrify you. I'm an emergency physician by background. I've said that repeatedly. We're all dying, some just more quickly than others. So I accept that. That's called mortality. I'm not here to separate you from your death. I would just like to delay it as long as I reasonably can. So in this case, when you look at this, 97% of our deaths in Kentucky are in patients over, or people over 50. And 90% of our deaths are people over 60. It is clearly as you get to midlife and beyond that you are at elevated risk, and when you get past 60, you are clearly at escalating risk. So first of all, yes, it's true that the mortality is heavily weighted towards people who are in the second half of their lives. But there's some folks who get really cavalier about this, which is kind of striking. Well, like they die anyway, or they're older people. I get letters every day from people who tell me that they really don't want to die, that they kind of value the one life they have. And so for them, it does matter. And so if you're in those high-risk categories, it really matters. And they're relying upon the rest of us to behave responsibly so they don't pay a price with the one life they have. So I'm not able to be cavalier with the fact that I'm not at high risk. I'm 48. I'm not at high risk. But other people are, and I think I have an obligation to not recklessly endanger them. So then the other thing is, people, if they think that we're inflating the numbers, our mortality statistics started at over 6%. So that was when our testing was not widely available. Over 6% of the people we tested who were positive died. Now testing is much more widespread. And the healthcare in Kentucky has been very good. So a combination of good doctors and nurses and hospitals, and also more testing. But as the testing expands and we find more of those asymptomatic people, what's happened is our mortality percent has gone down. So now 2.5% of the people who have tested positive have died from this, and it's going down. It is likely to settle in at 1 to 1.5% or somewhere in that ballpark. But put this in context. If the disease sweeps through rapidly, 1% of Kentucky is 45,000 people. 1.5% is 67,500 people. If we were to lose 45,000 Kentuckians, just 1% in 1 year, that's staggering. It's 45,000 people. There would be everyone in the state is likely to know someone who would die from this disease if 45,000 people died. And it would happen quickly. It would happen over the next 12 to 18 months. It wouldn't happen over the next 10 years. That's a concern, and when we see an exponential growth or the beginning of it there, it would be irresponsible not to act quickly to try to interrupt that. And I'm very happy at the moment because at this level we're not seeing the hospitals fill up, and we may be able to be plateauing that again, and so we'll see. James, can you show those other two slides, and I'll more quickly show this. This is what the governor asked me specifically to talk about today. There's a lot we still don't know about this disease. Now, I talked about this in a different context a week or so ago when I talked about other diseases that we know a lot more about. We don't know much about coronavirus yet. We're only still 7 or so months, maybe 8 months into learning about it. But we know in children that, well, we now know that there's a multi-organ inflammatory process that can develop in some of them. And we didn't know that until months after this disease had affected a lot of other people and overrun cities, because it takes months to develop or show up in these children. It's after they get over the initial infection and then their immune system goes haywire and starts attacking their own body. These kids could have coronary artery aneurysms. They could go, their blood pressure could drop so precipitously they're in the ICU getting aggressive fluids and medicines to elevate their blood pressure. They could have permanent blood vessel damage from vasculitis. They could have permanent heart damage from myocarditis. These are things we do not know fully yet. But if you're a 6-year-old and you become a cardiac cripple, they're probably going to care about that, and so are their parents, and so are their grandparents. We can't afford to be cavalier about that. We just don't know. If you look at young adults under 18 to 34, Nick Cordero has been in the media. Nick Cordero had COVID-19. Nick Cordero had blood clots throughout his body, and he lost a leg, and he subsequently lost his life. An incredibly fit-looking individual in his early 40s. We've had people with blood clots in their lungs. We've had people who've had strokes. We've had people who've had heart problems. We've got someone cleaning the Capitol here. You can have folks who get inflammation in the muscle of their heart called myocarditis. Pregnant women can have that after pregnancy, but if you get it from any condition, you can become a permanent cardiac disabled individual because you can't have the cardiac reserve now to be able to walk and do activities. We just don't know. But we know people have had blood clots in their lungs and blood clots in their legs. Then if you look down further, there were studies more recently come out that as many as 1 in 5 young adults say that up to 3 weeks after the illness, they're still not back to normal. That's not the flu. The flu lays you low for a while and then you bounce back. That's a lot longer recovery. And in people over 50, you're twice as likely compared to the younger people to still have symptoms 3 weeks after. It's a big deal. And then lung damage, and we don't know enough about this yet, but there is a subset of people who get this condition and it's like you poured Roundup into their lungs. It absolutely eats up their lungs, and then they don't recover, and they have permanent oxygen dependencies, or at least long-term oxygen dependencies that goes on for months. There's a lot we don't know. And so I'm not trying to fearmonger, I'm just trying to tell you, there's a lot we don't know. Now, if none of this concerns you, and all of these risks don't matter, then it's going to be hard for me to persuade you. But I get letters every day that tell me there's a lot of people in Kentucky who care quite a bit about this. And the last thing, this was in the New York Times, this picture and all. There are people who also I use this to remind me, there are people who talk about a brain fog or COVID-19 neurocognitive disability after this. So we've had people who don't ever really appear, at least so far, to return to their normal self. Who knows if they've had microscopic strokes because of a clotting disorder, or if there's some other implication for the blood vessels or the brain tissue. But we know it involves people's nervous system because some of the people lose their sense of smell, and that's a neurologic problem. That's their nerves not working for their sense of smell. And I mentioned months ago a friend of mine who's an infectious disease doctor up by the New York area who still doesn't have her sense of smell back normally, and she's multiple months after her illness. So, folks, you'll have to make your own decisions. But I've said this and over and over, as the governor said it, if you wear these masks, we now know a lot more. We have much more confidence that something simple like this, coupled with social distancing, can help us to protect the vast majority of people from death and disability, and can help us get our businesses open. So again, my ask to you today, like it has been before, is now that we know more, please wear these masks. This is what's going to help us get back to things until we get a vaccine. Thank you very much, Governor.
And I think he started off making us laugh. I think the point here is do everything you can to prevent getting COVID-19 for yourself or for spreading it to other people. And to do that, we need to be good role models. We need to make sure we're exhibiting the behaviors that we need others to follow, and we need to be helping out those that are making special sacrifices. So we have a few examples of that today. The first one is people trying to support our small businesses. Asking our restaurants to cut back to 25% is going to hurt them. And they have already been hurt by this virus. But we know that it is absolutely necessary based on where we are right now, and it's going to prevent longer-term closures if we do it right. So here's an example, again, of helping out in the community, of making sure that we support those small businesses. Order takeout. Try to be healthy. Order takeout. Oh, here. Proof that our kids are still our kids when they're wearing a facial covering. Incredibly important to get them wearing them. Incredibly important for all of us to be wearing them. And just one more today. Again, we want to show you those that have to wear so much more PPE every day, that are relying on us to do the right thing, relying on us to not bring COVID into one of these facilities. They have been sacrificing. You think we're tired of not being able to see 50 people at our house. What do you think our frontline healthcare workers must be feeling? But they power through, and so can we. So again, let's make sure we do the right thing, wear a facial covering, don't go to Florida or Texas or Arizona, travel inside of Kentucky if you will. Make sure you're not having big house parties or barbecues. Let's just do the right things. We're now going to have Mark Carter give us an update on contact tracing. I think our operation has gotten significantly larger and is going to continue to grow.
Thank you, Governor. Just a update on contact tracing, and we've got a slide here that summarizes some of our numbers. If you look at this slide, on the right side of it, you can see that those numbers, those are the numbers of contact tracers, disease investigators, regional team members, and social support coordinators that we have in Kentucky now that are engaged in the contact tracing effort. That totals up to 886 people. We had 431 folks in our local health departments around the Commonwealth that were already doing contact tracing before we ever started this initiative. They were focused on things like HIV and tuberculosis, substance use disorder, and the like. But now a lot of their time is taken up with COVID as well. So a total of 886 now doing contact tracing. That represents an increase of 455 people since May 1st. We do have the capacity within our CARES Act funding to add almost another 290 people, and at the rate that we're going, and if we continue to see the virus, the infection at the level that it's at currently, I suspect by mid-September we'll probably be at a full complement of people. Some of the questions that I get asked is, are people being cooperative when they're contacted by the health department? And overwhelmingly they are. We're typically, most of this is anecdotal still as we get our systems into place, but we're making contact with 70 to 75% of the people that are identified as contacts. And overwhelmingly, once the health department is able to reach people, they are being cooperative. They want to protect their health. They want to protect their loved ones. Certainly there are those that are uncooperative, but so far those have been far in the minority. A couple of other questions that I'm asked a lot. One, are the numbers sufficient? Do we have sufficient number of contact tracers in the Commonwealth? And the answer is, today we do. It is important to remember that contact tracing is just one component of the public health response. Dr. Stack and the governor emphasized masks, wear your mask, social distance. If citizens do that, then contact tracing can be a very effective tool to limit the spread of COVID. But as we've seen in some southern states, if you don't do those things, if the public doesn't participate, it can very quickly overwhelm the program. But right now, when we get a report every evening from our chief epidemiologist, and he assesses our ability to respond to the virus in a dashboard. One of the items in the dashboard every night is public health capacity, which basically means do we have enough disease investigators and contact tracers, and we've consistently been in the green there. So at the current time, we're in good shape. Let's see, the last thing is, the last question that I get asked a lot, and I'll address here, is just where do we see the contacts? And that one is across the board. I mean, we see them, of course, in congregate settings, employers, and you've seen the reports on that, but it's across the board. We have right now a flare-up down in Bell and Harlan counties that seems almost completely attributable to travel, but we're seeing it in employers, health facilities. It's just across the board. It's hard to single. There's not one certain thing you can single out. Indoor settings are an issue, and as we look at school returning, whenever that happens, that is of significant concern to us. But that's a quick update. I feel like the progress is good. We're in good shape, but we all worry about what might happen with the spread of the virus and what that might mean for our public health response. So, Governor, that's my update.
Oh, Mark, I think you took my list of questions. You want to put on the, we're trying to model good practices here. There you go. Thank you. All right, we have a packed house here in the Capitol Rotunda, socially distanced. Of course, we also have a number of questions that have come in from outside, so we'll answer as many as we can. First, I have a question here that I think I can just answer directly. It says, Governor, can you please respond to President Trump's suggestion that America should delay the November election? I do not believe that America should delay this election. I believe that we should have no excuse absentee ballots, just like we did in the primary. I believe that we ought to have early voting. I believe that we should have more polling locations open this time around. I believe that if we do all of those things, we can do it safely, and we should do it at the normal time. So we'll start over here.
Yesterday,
Hayden.
you did, yes, Hayden.
Yep.
Hi. First timer for these COVID pressers. We watched the Jefferson County in-person appointment site for unemployment help fill up in
Right.
a matter of hours. We watched there be significant problems with the website crashing. You mentioned that you knew a week wouldn't be enough. Is there going to be extended help at this in-person site? Because it's clear the people of Jefferson County need that assistance.
So the question is about the in-person site that is being set up next week, where all 5 days there are going to be in-person appointments for citizens of Jefferson County and the surrounding counties. It's already fully booked. No, 1 week is not enough. Long-term, we want to reopen offices for this now and going into the future in our different regions. How quickly we'll be back in Louisville will depend on what is the most efficient way to deal with the vast majority of claims. And so, for instance, these last 2 weeks, we've needed our people in-house to finish up that last 5% of work that E&Y did the first 95% on. So when we make these decisions, it's all about what's the maximum number of people that we can help during this week, and what are the steps to take to do it. No, 1 week is not enough anywhere. And we also need to get these folks out in other parts of the state too. We'll be back in Louisville as soon as we can, but my hope is that we're going to resolve the vast majority of Louisvillians' claims without them even having to come in. So again, there are really two types of claims that are left out there. One is initial claims that are disputed in some way and that take a final decision. And we talked that there are roughly 68,000, there are less of those today. And we think we may actually have a process improvement that hopefully we can announce next week that'll help us move faster on those. The second one, and I imagine it is the majority of what we will see in Louisville, are people that originally qualified. And remember, this process they created to be a pain. It's really unfortunate they created a process to be a pain where you have to apply, you have to get approved, you have to go online and register, you have to request your first payment, and then every 2 weeks you got to request a payment again. It's those subsequent 2-week requests where there have been errors. We think we can fix those pretty fast. For those that come in person, we can fix them there, but a lot of others this week and next week are going to be getting calls to fix them over the phone.
Does the state take any information about cases that do spread in workplaces? And also, in terms of contact tracing, how often are contact tracers finding that the cases are spreading in workplaces?
The question is on contact tracing. We get the information provided by the local health departments about different clusters that occur. A lot of them, well, just about every place is a workplace is the challenge, right? A restaurant is a workplace. But what we see is that it can happen everywhere. It happens more where there are more cases. But when you look at Harlan and Bell, we believe that it started all from vacation, but then boom, I mean in workplaces, in healthcare areas, in sports. So what we see less is one specific area of employment, and what we see more is areas where one person who has it that doesn't know can quickly infect a community. But I do believe that we've gotten a little lax in our workplaces. And it's primarily anecdotal for me, meaning examples that have gotten, but a whole lot of people that are back to 100% of everybody back in the office. And we shouldn't be there until we're done with this. If that means that we rotate folks in and out, then good. I would still really suggest people stay down around 50%. If people are productive virtually, don't mess with their production. If some aren't, it doesn't mean that 50% of every area of your business, if I was thinking about cabinets, for instance, or different entities, some of them you may need to have 75% of people in. Others, we've actually found out in CHFS that we've increased production by certain types of employees of being home. So it's the best I can do is encourage there. But I would be very concerned if I was an employer and I had 100% of people coming in right now because somebody's going on vacation or somebody's friends are going on vacation, and it just makes it more likely that you could infect your entire office. Answered this one. There's a question here on Kentucky Kingdom. We have received a couple complaints on that, are speaking directly to Kentucky Kingdom itself. We'll provide more information when we have it, but when we do get those complaints, we do reach out.
Cases continue to be tied to travel, but you consider changes to the travel advisory that's in place right now?
The question is if a lot of cases are tied to travel and the origination of cases are tied to travel and then community spread, would we consider changes to the travel advisory? We're pretty limited based on a lawsuit that went in front of a federal judge and the decision that came out of that. But what we are seeing is more and more private employers and even us as a public employer say that if you're going to go to a place where we know people are bringing back the virus, you're going to need to wait 2 weeks before coming back to work. That could be the strongest motivating factor to ensure that people don't do it. Stu?
I have a question. You talked the other day about failing shopping for Kentucky Lake. Do you have statistics that show that people are in fact staying in Kentucky facilities in Kentucky?
The question is, do we have statistics on more people staying and vacationing in Kentucky that are from Kentucky? I believe I did see some of that from tourism, but I think I saw it in a story in a different context, not getting it directly. I do think that it is up, but we will see if we have data to support it. And you know, it's one where if you need to get away in a safe manner, a place that you can clean and that you can keep clean. The more you stay in Kentucky, the better, and the more that you don't create a lot of contacts when you go, the better. The challenge with a place like Florida is what most often happens is somebody goes on vacation and they say, I'm finally on vacation, and they go to a restaurant, they go to a bar, they do all the things that they normally do. But right now, there's a lot of stories about people who went down who didn't do any of that, but just the virus is so hot there that they ended up interacting with just enough people to contract it and bring it back, and the consequences are just devastating. WEKU from a listener. Normally I get $600 on my card by this morning. I found other states haven't received theirs. I believe what this is a glitch that occurred from the federal side that's delaying things, we believe, by a day. Now this is very, very new, but for a period of the last 4 days on the federal side, there's been an issue that we believe is resolved, and hopefully this person will see it coming into their bank account. If not, we in other states will need to go back to the feds to make sure that we can fix it. Tom?
We've spoken about evictions, and I believe you had legal folks meeting for mediation with that federal lawsuit up in northern Kentucky on evictions. Any news out of that? We have
been in mediation all day in northern Kentucky on evictions here in Kentucky. I haven't gotten the latest update, but on the last one, it did not appear that there would be a resolution. And if there is not a resolution, then that case will move forward, and we will defend our order that we believe prevents people from carrying out evictions. Now, are there people out there gaming the system? I am sure that they are. But are there people out there that are suffering because of this virus or its economic impact that we can't allow to be kicked out on the street? Yes. And so our goal was to try to find the right balance to protect those that needed protections, but those that can pay should be paying their rent. I'm not hopeful we're finding that balance today. And remember that a mediation requires different parties to agree, which requires everybody to be reasonable. Some days that's harder than others. Joe? Yeah, this is a question about testimony today from an individual who was terminated from their job heading, at that time, I think, the unemployment insurance group. And first, let me say that everybody that's here or those at home that cover politics or have watched see a similar story, though not in unemployment, just about every year, that somebody is terminated. I guess they decide to go out by trying to burn down the house. They make these big allegations, and then you got to go to court or an administrative proceeding. 2 years later, you get the decision that says, no, nothing wrong was done by the state, and they should have been terminated, but by that point, there are no salacious allegations, and it doesn't get any press. I lived through this in the AG's office. You know, when I was in the AG's office, there was a female employee who claimed her female supervisor fired her for being female. And we knew it wasn't true whatsoever, but the allegations were made. The previous governor, Matt Bevin, mentioned it at a bunch of these things. Different people stood up on the House or the Senate floor and talked about it. And then we got a decision from the Court of Appeals 2 years after saying we were fully in the right and there was nothing wrong done whatsoever. I believe here we have somebody who their relationship certainly got messy by the end, but it appears that the termination was valid, and they're now kind of exhibiting some of these same things that we have seen in the past. My understanding is that everything that was raised by that individual as they were leaving was addressed. I think it was even addressed in a letter. I believe that today there was some testimony that they alerted a day earlier about the first data breach. What I was shown was that they forwarded an email to people that are getting thousands of emails and then went home. If you're the head of something, you got a bigger obligation than that. And I believe when the Inspector General report comes in about that data breach, it's going to show a number of people in leadership positions should have done more. And we're going to make sure that we correct that, and we're going to make sure that we're transparent about it. Karen.
We're getting some listeners saying, just so you know, that they're still getting that robocall from UI, but it's every few days and it's just a robocall. And they also want to know if they do set up an appointment, will they be removed from that queue and there's an opportunity to talk to somebody in person?
So it's first an update that we do have a robocall that goes out that's telling people that we do know about them, we haven't lost their claim, and they'll be getting contacted. I hope that's not confusing to people, and it could be. And we probably ought to question whether or not, with the amount of calls that we have out there, that those are necessary. Tell me the second part again.
The second part is if they've set an appointment.
Yes. If an individual has set an appointment, my understanding is that they don't come out of the queue to be called by EY or anybody else. And we'll have to make sure that if that is resolved, we need a way for them to let us know so that we can fit other people in their appointments. I do believe in the long run that most people will be able to be helped through the phone call that they are getting, but in person is important. And we want to make sure that we have those possibilities. Ooh. Right.
And is there any thought about extending the time window for expired
The question is about real ID and driver's licenses, and apparently Joe had to sit for 4 hours in an E-Town office. And for that, I'm sorry. And we don't want anybody sitting in a waiting room for any period of time. Did you wait in your car? That's a long time to be in your car. We do need to look into how we're doing at Real ID. I will admit I've been so focused on this that I need to get that update. We also need to continue to make it easier to renew your driver's license. I know that we've had a mail option, and we can consider extending that deadline like we have before. I will want to hear out any concerns from the other side about whether or not that there are specific types of licenses where you have to take any type of test. And I also know that we've got to get our driving tests up, which we're doing a better job of, because there's a lot of 16 and 17-year-olds out there that are really angry because they want a little bit of freedom, that they have to use responsibly and wear a mask when they're doing it and not go see more than 10 people. Chris. I'll come back. Yeah.
Governor, today, Churchill stopped selling some tickets to the Derby. Two-part question. One is, if the Derby was sold today, would you feel comfortable you going to the Derby? And second of all, we don't see a change in the numbers, and the Derby is held, will you still be there to hand out the trophy?
Question is about the Derby and news that Churchill Downs has paused infield tickets. Would I be comfortable today going to the Derby? And if the numbers are where they are, will I hand out the trophy? I think everybody wants to see us make improvements on where our numbers are. The very first threat to all of us, and that means to Derby too, was the escalation that we were seeing. I hope that we have stopped that. Again, it's going to take time, and we can't let up. You know, we could do a great job for 2 weeks and then go back to what we were doing, and it continued to escalate. If it was on that escalation, I would have to think long and hard before really going anywhere. And that's about a decision for me and my family. If the numbers are still where they are right now, in September, that means we've done a great job plateauing them. And if that's the case, I probably would go and hand out that trophy. So we've got to get control of this. I know Churchill, or I hope Churchill, is looking every day at where we are and rethinking on how they can make it safer. Again, we've got some really good examples out there. I always use the Lynn Family Stadium, but it's because they're doing a good job. And we have some bad examples out there. You know, Derby's got to be a good example. Got to be.
You know, when you're talking about the number of cases in children under 5, you've been putting a lot of emphasis on those numbers as we're seeing increases there. But when we're talking about school-age children, maybe more so kindergarten through 12, 6 through 18, what are the numbers showing in that age group? And would that lead you to, again, believe that it might not be the best idea for all kids to go back in person, or are you waiting to see how those numbers change over the next few weeks?
I was looking to see. The question is on children just a little bit older than I talk about, those maybe even K through 12, and what that suggests to me about our ability to go back to school. We get a breakdown by age, and I'd want to look at that. But it's fair to say that the numbers are getting increasingly younger. But that's also what happens in every major surge we've seen in states. It starts with those that are younger, because by and large those that are older are taking extra precautions. But then what they see in the escalation is you have a big increase, especially in 20s and 30s, and we're seeing it younger, and then it hits the 60s. Those pop up a couple weeks later, and then it hits the 80s again. I am concerned that younger people are getting the virus for a couple of reasons. Number one, they can spread it. Two, they can be harmed. But three, it suggests we need to do better in our practices. And if kids are going to school and there's a lot of them there, we need to be in a good place. For school openings, I worry primarily, I worry both about our kids. I also really worry about our teachers and our faculty that'll come into contact with so many different individuals in that day. And that's why I recommended we move any in-person classes back until at least the third week of August, to see that we can get control of this. And if we get control of it, it will also say the steps we are taking are very effective. In other words, if everybody wears a mask in school, that it's going to add a significant layer of protection. So we're still waiting on seeing that, and I wish I could give people a better schedule and recommendations that we'll make, but our job is to make sure it's safe, and if we don't know that it's safe until 2 weeks out or 1 week out, then we got to deal with it.
Members of the United States Postal Service reach out to me today in terms of a report that says closures are likely to occur in states across the country. Have you heard of any closures that could be happening here in Kentucky, the United States Postal Service?
The question is, have I heard of any closures of the United States Postal Service and branches? I've not received word of that. If we have, it hasn't gotten to me.
This is a question for Dr. Stack. Does he have any further, I'm wondering if contact tracing is offering any further insight on how the virus spreads indoors versus outdoors?
All right, question is for Dr. Stack, and if contact tracing or I guess any other evidence that he's seen gives him any more insight on spread of COVID-19 indoors versus outdoors.
I guess the evidence that I would reference for the spread indoors versus outdoors are some of the studies the CDC has already shown. So we've shown earlier over time how people in a church service for a period of time rapidly spread infection in an indoor space. That was before masks were universally recommended and people were asked to use those. But by direct contrast, people in a beauty shop, I think, in New York, all wore masks, and 2 people who were cutting people's hair and styling people's hair had active infection, and 137 people, I think it was, who were exposed to them for an extended period of time right in front of them getting their hair done did not get infected because both the stylist and the person getting their hair done were wearing masks. And so we know that the masks work and protect people from this. As far as indoor versus outdoor explicitly, the reasons we believe outdoors of lower risk is because the volume of air circulating is so much more, so you don't concentrate any of the risk that could happen from virus floating in the air doesn't get concentrated. Number 2, you're not as likely to be as close to people. If you're in a small room, you just naturally get closer together than if you're in a big open space. And number 3, if you're out in the bright sunlight, the ultraviolet light is thought to help. In hospitals, you see those blue lights that they put up, which are there for UV radiation to try to kill infection. So most public health experts believe it is safer to be outside, all things being considered equal, but it is safer by far whenever you're close to someone to wear a mask, and whenever possible to stay more than 6 feet away from them.
I think that's really important in that we see a lot of clusters that are inside, but we have seen spread that is outside too. And so we don't want people to have a false sense of security that just because you're outside means you don't have to wear a mask and you can be as close to other people as you want. Again, you have to follow those best practices, but we do believe outside is safer. But that all depends on our behavior, if it's safer. If we follow guidelines really well inside and then don't follow them outside, then we'll see more spread outside potentially than inside. Stu?
The hope that this week is leveling off. And you also talk about staying vigilant. Do you envision that staying vigilant to be having the mandatory mask in place throughout the year, until the end of the year?
I think it is very possible. Well, first, I think it is probable that we will extend the requirement to wear facial coverings beyond the 30 days. I would guess that it would be at least another 30 days after that. Why? Because it's working. And now we are seeing more and more evidence of it, and we are also seeing everybody who nationally is in charge on the public health end of trying to contain it, of this becoming something that they are getting even stronger and stronger and stronger on, including taking on some governors directly, which I haven't seen up to now. So I believe that we ought to be ready to wear facial coverings in certain situations until either we get this thing really far down and there's some reason that we think that it's not going to come back, or even a vaccine. But if we know that something is protecting us and keeping our economy open, we ought to be ready to do it. It's a lot less than our people as Americans have been asked to do in other crises. Tom.
Spoke about Churchill Downs and the Derby here just a few moments ago. Even before the Derby, we've got the State Fair coming. Are there any changes in the wind given how our numbers are doing with the State Fair?
Questions on the State Fair, given where our numbers are. I believe that we have sent an additional series of recommendations over to the fair. I think we did that yesterday for them to consider in light of where we are right now. And remember, I mean, anything that's held out there or anywhere else around Kentucky that's large, if not done well, can ultimately upset other opportunities to do large events. For instance,
can you say what those recommendations were?
I'd have to get the recommendations. They came directly from public health. Karen or Joe? I can't tell. Joe's a little to the left. Let's go.
To clarify on that Northern Kentucky landlord evictions lawsuit, if there's no resolution on that by Saturday, does your order guiding those still apply, or are those evictions now allowed based on the Supreme Court?
The question is, if there's no resolution in the mediation today in Northern Kentucky, what does that mean for the status of evictions? I'm going to tell you what my belief is, and ultimately that might have to be litigated as well, is that the courts will allow eviction proceedings, which is the actual proceeding in court, to occur, though everybody's entitled to a trial on that, and those aren't going to occur, I don't think, until October under their order, if we looked at that. But the proceedings could continue. But I believe that our order prevents enforcement, whether that's the sheriff's offices or others, of the outcomes of those proceedings. All right, Joe, bring us home. Question is on, he was reading our order. Apparently it just went up until July the 6th. I think, yes, we'll definitely consider extending it beyond that. I appreciate you bringing it to our attention, and we'll take a look. All right, everybody. Positivity rate down, which is good today. Cases still at a higher level than we'd like, but we don't see them escalating the way that they are in other states at the moment. But where we are is fragile. Right now, this is the best thing that we are doing that's protecting people around us. Let's make sure that we continue to wear them. Let's make sure that we continue to do the right things. We can do this. We can come together as a people, and we can get this done. So we're going to end today with a video from Coach Butts, who is the assistant coach to the University of Kentucky women's basketball team, given a very important but a very definitive message that wearing these facial coverings is something we should all do. We appreciate her strength on this. Former head coach of Arizona, one of the best assistant coaches in the country. We appreciate her making this video.